Morning, ma'am.
To the next paragraph. Next paragraph. Download చేయలేదు.
స్లైడ్స్లో ఓపెన్ గూగుల్లో వస్తున్నాను.
ఏం వస్తుందంటే
దానికి యారో
ఇలా వెళ్ళినా మామూలుగా ఇలా ఫ్లై అన్నమాట వస్తుంది కదా. ఇందులోకి ఇప్పుడు మనం మధ్యలో ఇది కాదు ఇంకొకటి ఉంటుంది.
డౌనాలు వస్తుంది.
ఇంకొక ఇంకొక ప్రోగ్రామ్ కదా. ఇది చెప్పండి.
మీరు ఒకసారి వినిపిస్తుంది కనిపిస్తుంది.
హలో, కనిపిస్తుందా అండి స్లైడ్స్ అన్ని? హలో,
Yes, ma'am.
ఓకే. Good morning, everyone. I am medicine PG Lakshmanitya. Today, topic of discussion for you people are hepatitis, that is acute and chronic hepatitis. I will explain it briefly about what is hepatitis and what are the causes of acute and also the chronic hepatitis, what are the measures to be taken. Coming to the introduction, hepatitis is a broad term which means inflammation of the liver. It's commonly caused by the viruses, but the most common are viruses, but some other causes are chemicals, that is any toxin exposures like alcohol and autoimmune disorders and metabolic disorders. Uh, Most common are viral hepatitis, then the alcoholic hepatitis, then autoimmune hepatitis, and non-alcoholic steatohepatitis, and many other causes are there. Coming to the brief discussion about the viral hepatitis, because it's the most common type of hepatitis all over the world. There are major five types of hepatitis viruses are there, A, B, C, D, and E, and many are G, F, G is also be there. And acute viral hepatitis A is always an acute short-term disease, while hepatitis B, C, and D are most likely to become the ongoing and chronic diseases. And hepatitis E is usually acute but can be particularly dangerous in pregnant women. So the only acute hepatitis are A and E. B, C, and D can have ongoing process and can lead to the chronic hepatitis. Other less common causes are cytomegalovirus infection, herpes virus infections, rubella virus infections, and Epstein-Barr virus infections. The overall incidence is viral hepatitis is a major public health concern, and 10 million cases occur worldwide. It's nearly universal during the childhood in developing countries. India is a high endemic for hepatitis A virus infection because of the improper sanitation. Annually, over 1 to 2 lakh Indians die due to hepatitis B virus infection. Hepatitis A virus is a highly contagious liver infection caused by hepatitis A virus. Hepatitis A virus is a ribonucleic acid virus of enterovirus family. It causes acute hepatitis. The patient will be presented with jaundice. And sometimes the patient will be having the acute liver failure. In acute liver failure, the patients, along with having the jaundice, we will be having the bleeding tendencies and the defective synthesis of the liver and all. It is self-limiting, and there will be no chronic or long-term complications associated with hepatitis A virus. The incubation period is 3 to 5 weeks with an average of 28 days. The most common transmission is fecal-oral transmission, that is improper sanitation, we're having unboiled water and all. Sources of infection is product individuals, poor personal hygiene, poor sanitation, contaminated food, water, selfish, person with supplemental infections, and some with the food handlers. More prevalent in the underdeveloped countries. Okay. What are the clinical features? The patient with hepatitis A virus infection can be presented with non-specific symptoms like fatigue, fever, right upper quadrant pain, nausea, vomiting, jaundice, and recent onset of weight loss, loss of appetite, and alexia is loss of appetite. Itching is because of any any type of some type of jaundice like obstructive jaundice can cause itching because of bile acids accumulation in the body. And the patient will be also having the sharp pain in the right upper quadrant pain of the abdomen. What the lab is to be done when you suspect a case of hepatitis A virus infection? We have to do the IgG and IgM antibodies for testing for detecting the viral antigen associated antibodies. IgM antibodies show the acute infection, and IgG antibody shows previous infection or immunization. I think if people know about IgG and IgM antibodies, IgM any kind of infection, IgM antibodies indicate the acute infection. That means acute infection and the body is responding to the infection. And IgG antibodies are long-term antibodies of the memory antibodies. So that indicates that the patient is having previous past history of infection. For the management, there are no drug therapies for the treatment of acute hepatitis A. It's mostly the symptomatic management, and the patient sometimes need a hospitalization because of acute rapid deterioration in the functioning of the liver. Normally, the functions of the liver includes it will produce the glucose, it will produce the fat metabolisms, and will one of the sources of protein catabolism and protein synthesis and all. And it also responsible for production of clotting factors and albumin production and all. So when there is a defect in the functioning of liver, all these functions of the liver will be impaired, and the patient will be having the low glucose, recurrent hypoglycemia, and the jaundice because of abnormal bilirubin metabolism, low albumin, low prothrombin time, low clotting factors and all. So when the patient is having any abnormalities like hypoglycemia, recurrent hypoglycemia and all, you have to give the continuous glucose infusion to the patient to maintain the serum glucose at optimal level, and you have to give the diet, a restricted diet. And if your patient is having any abnormal floating abnormality, then you have to give the vitamin K, and IV and fluid management and anti-infectives if the patient is having any nausea or not. Then hepatitis B virus infection, it can cause both acute and chronic virus infections. Acute hepatitis may last up to 6 months. That means any acute hepatitis is the infection within the period of less than or equal to 6 months. And the infected persons can able to pass the virus within this time. Chronic hepatitis B defines persistence of hepatitis S antigen in the serum for about more than 6 months. The incubation period is 2 to 5 months, and hepatitis B virus is a complex structure. The structure of hepatitis B virus is complex, and it is having the structural proteins like hepatitis S surface antigen, and hepatitis C core antigen, and hepatitis E and independent proteins circulating in the blood. The presence of hepatitis S antigen, HBsAg antigen, it indicates the patient is having the infection with hepatitis B virus. And hepatitis C antigen, and E antigen indicates the replicative status and uninfected status. The presence of hepatitis C antigen in the blood of the patient will indicate the patient is having the ongoing infection. And hepatitis C antigen indicates the patient can transmit the virus to the other humans when there are any inoculations in the blood and all. Mode of transmission is usually sexual contact. It is considered as one of the sexually transmitted diseases.